Very long conversations about this, because I think it's extremely important for doctors to be in jobs where they get to do something that they feel good about. It improves patient outcomes when doctors are doing work that they feel good about and are not burnt out and are happy with their day-to-day. I think there's some pretty big differences working with SunCloud than other locations I've worked at in the past. The focus on clinical excellence is very high here. The goal is never to be rushing through an encounter, to never be making something hit so that you hit a certain census or certain number. The goal is to be taking care of everybody in the way that you'd want your own family or your own loved ones to be taken care of. And a lot of docs these days are seeing the alternatives. They're talking to places where it's about numbers, it's about revenue, it's about things like that. And that's just not the way that SunCloud's structured from the top down, and certainly from the physician standpoint. And I know that's made a big difference with our new doctors, not only hearing about that, but since they've been brought on board, also getting to experience that as well. I've also talked a lot about being able to be part of a community of other physicians who are like-minded and also care about that. When you're at a job where other people are treating it, kind of like a come in, get your job done, do it as quickly as possible, maybe seem like you care at all, or maybe just don't even pretend to even care about your patients, it's demoralizing. It's hard to be around and knowing that other people are getting that kind of care. Medicine is, despite what people say, is still more than a job, and it's important, when your child is having the hardest time of their life, that somebody's there that actually wants to see them do well and cares what happens for them. And thankfully in child and adolescent psychiatry, I think we have a lot of very passionate docs in the field across the whole country. People don't spend extra years in fellowship to make similar or sometimes even less money because of some need to ride their Lamborghini or anything like that. They go into the field to help kids and take care of kids, and that really drives true with a lot of the adolescent psychiatrists I've met. So being able to say, you can come here, actually do the work you want to do, see kids get better, be part of the process of helping them get better, that's the number one thing I think that most child and adolescent psychiatrists are looking for out of a job.